Now, Nasrec Field Hospital, just near Soweto here in Johannesburg, has received its first COVID-19 patients. That's thanks to a group of doctors and activists and healthcare professionals who appealed for help last week, Friday. They asked people to help with oxygen concentrators or donations for the patients at this field facility. Well, to tell us all about this effort and how it's gone so far, I'm joined by public health specialist Lynn Wilkinson now to really give us a little bit more. Lynn, first up, well done. I must say it has been a huge effort because the Nasrec Field Hospital is one of those key field hospitals in and around Johannesburg that's been set up by the Gauteng Health Department to assist. And we're seeing the numbers now rise. Tell us exactly what led you to raise the red flag and appeal for aid last week.
Hi, thanks for having me. Well, let me just clarify. So Nasrec was already open, the field hospital, but only for well people, so people that didn't need any clinical care. And many of us who are work in the public sector environment, I've been working in primary healthcare in the public sector for the last 2 or 3 months, preparing them and helping support getting them COVID ready. We realized that the primary care clinics didn't have any, couldn't get any more patients into oxygen beds at the big public sector hospitals in Joburg because their beds were full. And so we needed more oxygen beds, and those were they weren't enough at the public sector hospitals. Because the Nasrec facility had 600 beds already set up for well people, we met with the department to see whether we could work together to take over some of those beds to provide what we call intermediate care, which is also providing oxygen and clinical care, so that we could, what we call, decant the public sector hospitals, take away their more stable patients that need oxygen. So we free up their beds for patients who need higher care from more specialized and bigger groups of healthcare workers.
Okay, what exactly then were you looking to get? You're getting oxygen concentrators, among other things, and how has the response been?
So the response from the public has been absolutely amazing. Really, we want to thank people for their ongoing commitment. We all know that COVID is tiring people and it's not easy. So we really appreciate that people have also made the funding available so we could act extremely quickly. So from yesterday, just to let you know, we now have 100 oxygen concentrators on site. Which is absolutely brilliant. We're now working through some of the other slightly more complicated issues because all the patients that used to be at Nasrec were well patients. They could go to the toilet themselves, they could feed themselves, and they didn't really need any help. Unfortunately now, because our patients are on oxygen and in their beds, we have to also think of other things like bedpans and wheelchairs and various other things that weren't in the facility because of the type of patients they were caring for. So we're also trying to urgently meet some of the other needs for bed-bound patients until they get well enough to come off their oxygen.
And how is the response to this latest drive?
So again, we haven't put out another appeal. We're also trying to see whether we can source some of the equipment from some of the public sector hospitals, also speaking to some of the suppliers to see whether they can donate. But our account is still open that we set up, and WITS Health Consortium helped us set up a PBO at WITS. So the donation account is still open. We would very much still appreciate donations because there's still many things that we need to get for our bed-bound patients. We're working very hard to make sure that happens. From this morning, we have our first now 10 patients who started arriving 2 days ago. But there's lots of complexity for us that we have to sort out. Unfortunately, the public sector ambulances are overrun at the moment. So it's very difficult to get an ambulance to pick up a patient from a tertiary hospital and bring them to us. So we've even had a doctor loan us their minivan, and we actually go in full PPE to fetch the patients with oxygen so that we can get them out of the public sector hospitals and don't have to rely or wait for the ambulances. So many things that we're trying to work through at the moment to get the patients out of Baragwanath, Charlotte McClurky and Helen Joseph so that they've got more beds for people that need higher level care.
Now, I understand you say you're still open for for donations, and how do people do that?
So I can share with the eNCA the link. It's you just click on it, and then you can either transfer by EFT or deposit, or however you want to do it. And then you also get just sent a receipt from WITS to say that your donation's been received, etc. So that you also have a record. And also, obviously, if you need now we're so organized that the WITS can even provide you with a tax certificate if you need that for your donation. So WITS has been really helpful to help us set up the donation system to make it work quickly so that we can collect and then immediately utilize the funds to buy what we need.
Does the link have a name?
I think it's called WITS Giving, but I will, let me just quickly have a look for you.
I think it's important to know, while we are looking at it, I just want to share with our viewers that in this drive for to bolster the public healthcare system in Gauteng, as we see the numbers growing, you are not doing this by yourselves. Of course, you are good Samaritans, you are doctors, you are activists, you are people who've been involved in the public healthcare system for some time, but you are collaborating with the Gauteng Health Department, and you've got Dr. Bandile Masuku, who's the MEC for Health, who's even offered to do a night shift or two at the Nasrec Field Hospital, as everybody's trying to put their hands together. I mean, Gauteng is now the epicenter of the pandemic in our country.
That's absolutely right. We're working very closely together. Remember, the Nasrec facility, as you said, is a Department of Health site. They've already, they put in all the beds. They've got all the waste management, food management, all of that set up, and that's a huge undertaking. And we're working together with them to see which parts of this intermediate care, as we call it, which is the oxygen beds that need clinical care, how much of that they can take on, working very closely with them. We just really intervene so that we can make this happen as quickly as possible. Okay. We have a group of 35 volunteer doctors, nurses, clinical associates who are giving their free time to do shifts to cover the beds while the department has more time to sort out.
And it's good to know that Dr. Masuku might be one of them. Did you manage to find the name of the link for us while you were looking there?
Yes. So it's called Nasrec Giving.
Nasrec Giving, as in Nasrec, and then Giving. And you could find that if you Google it on. Is it linked to the Wits University site?
It's yes.
Okay, no, that's fine. Thank you very much, Lynn. But well done to you, and we really salute you because you've given up time to contribute to this effort. It is all about sharing and giving and solidarity. And as we see the numbers rise in Gauteng, every little bit of help will count, especially in the public healthcare sector. Now, that Nasrec Field Hospital has been gifted with 100 oxygen concentrators at this stage, and you still need more for those 600 beds of well people. And we know that it's going to get worse and worse from what we are being told by scientists. And well done as well to Dr. Bandile Masuku, the MEC of Health here in Gauteng. And now let's take a quick look at your Thursday weather.